Raheen worked that day. He came home. He was fine. He ate. He laid down in bed. He said he was going to take a nap. I was like, okay. I left. Stepson calls me and tells me that he's not feeling well and he was just needed me to come home. I get home. He's laying on the floor, thrown up in a lot of pain and everything. So I called 911. Got to the hospital, they did tests. They realized that we have to fly him to Florida Hospital in Tampa.
We got word from our sister hospital, Florida Hospital, North Pinellas, that he was coming to us emergently to have a dissection repair.
Raheen was diagnosed with a thoracic aortic dissection, which essentially is a very large vessel. It's the largest vessel in the body, and it supplies blood to all the major organs. And his was rupturing, it was failing. And his only option was emergent surgery.
He was afraid and nervous and scared because he had no idea how sick he was. We try to wait until the family gets here because sometimes it may be the last time they see them awake. It may be the last time they see them. That's just the nature of the surgery.
When I met Miss Carol and Raheen was being wheeled into surgery, she hugged me, and to me, that's showing me the love and the comfort that I needed right then and there. No one never promised me everything was going to be okay, but they prayed for me. They constantly gave me little encouraging words. They gave me hugs, shoulders to cry on. To me, that's love. Going out of your way, to make someone feel better, to me, I feel like that's an expression of love. When Dr. Bloom came and he told me, the surgery went good, but he's just not sure what other damage was done to the body. He's basically fighting for his life. And it was just something I wouldn't want anybody to, experience.
Most people with this condition don't even make it to the emergency department. So for Raheen, everything lined up perfectly for him to get the care he needed and certainly the outcome we all are pleased with.
The first thing I remember was getting candy. And it was like the best thing on earth, a piece of candy.
I had been sneaking him ice chips. And I thought, well, if he could have an ice chip or two, then I had Blue Jolly Ranchers one night. So I gave him a Blue Jolly Rancher. And that's the first thing he remembers of me, is me giving him that candy. And his face lit up like a little kid. It was like, because it was the first time he had had anything of taste or texture or flavor for like almost 5 weeks. And I almost think at that point it was a turning point for him when he realized, all right, maybe there is something to look forward to.
I have so much respect for nurses now, just because you don't realize what they go through on a day-to-day basis and the things that they have to do, the patients that they care for. It's like they really start feeling for that patient as well. The way they took care of him, I really felt like they treated him like if they were their family. It was just amazing. It went from actually thinking that he wasn't going to make it to we're actually going to get married and moving on, with our life, and we're happy. And to have your life turned around and just basically changing right in front of you, to where we are now. I would have never thought that, we would be here, but we are, and I'm so grateful.